Hi everyone, I am Kara Sundlin. Thanks for joining us on this Facebook Live. Do you have any pain? Is something on pop or snap or not crackle? But Orthopedic Surgical Partners is here, dedicated to delivering superior orthopedic care in Connecticut. And I'm happy to have Dr. Stephen Scarengella with me to kind of answer some of the common questions that people might be having. So thank you for being with me.
Oh, my pleasure. Thank you for having me.
So I think a lot of people, when they hear, especially orthopedic surgery, they immediately think surgery. Like, I don't want to go have surgery. So they live in pain longer than they probably need to. Surgery is not always the answer, right? In fact, you guys do a lot of other things first.
Absolutely, yeah. Surgery is kind of our last resort for most of the problems that we tend to see. It certainly can be a very successful and helpful treatment, but we always usually try to do conservative care first, and there's lots of opportunities to do that. And the majority of the time, with a lot of different things, we can kind of get them better with that type of treatment plan.
Okay, so when we talk about conservative treatment options, what does that look like, say, if you've got back pain or knee pain?
So a lot of times we try to identify a cause, for the pain, maybe an activity they may be doing or some type of a repetitive activity that might be causing some of the trouble, and we try to modify some of the activities that may be contributing to it. But in addition, we usually are working closely with physical therapy and rehabilitation specialists that can be very helpful and useful with that as well. And then we usually will also do targeted injections at times for certain problems that can be very helpful at reducing inflammation and pain and eliminating the issue.
So your specialty is hand and upper extremities. So what kind of problems would we see you for?
So obviously a lot of things involving the hand, the elbow, and
tennis elbow,
yes,
carpal tunnel syndrome.
Absolutely, all of that, and up to the shoulder. And we see a variety of things from trauma to repetitive tendon issues, as well as nerve issues, and also arthritic problems and such that can cause quite a bit of problems as well.
Okay, so when we're first starting to feel pain, like, how do we know if we need to go to the doctor? Is it length of time that we've been living with this, severity, both?
I think it's a little bit of both. I think certainly if it's severe and if it's really debilitating and causing you difficulty, it's always a good idea to get it checked out, because it may be, again, a simple solution to kind of get you feeling better. And certainly if it is something that's ongoing and not improving, or for sure if it's getting worse or progressing, then certainly very important to get in and get it checked out just to figure out what's going on.
In fact, if you do the early treatment, would we maybe be even avoiding more serious problems by making sure we get things treated on the earlier end?
Absolutely, yeah. It's kind of like watering a plant. If you don't water it for a few hours, you can kind of get it back pretty quickly. But if you don't water it for a week or so, it becomes a lot harder. So with some things, you really want to get at it quickly before things kind of get out of hand.
Yeah. And you have a lot of coordination also between your surgery and your therapy and your rehab, because that's really, really important. We've all heard those stories. I remember my father got some rotor cuff surgery, and he was a bad patient. He didn't listen. And so they ended up having to redo the surgery because he didn't do what he was supposed to do with the therapy and all that kind of stuff. This is years and years ago. But you really coordinate, so the physical therapist can really tell you what needs to be done. You can tell them. There's a lot of communication that goes on at OSP.
Absolutely, yeah. The therapy is a critical part of the recovery and most of the things that we do, and in particular with the upper extremity surgeries. So I personally and my colleagues have therapists that we work regularly with and that we're in communication with all of the time. And we try to coordinate the treatment and the rehabilitation very closely, because I think the therapy is every bit as important as the surgery in terms of the outcomes.
And there's also a lot of less invasive options now that we might not be aware of.
Absolutely, yeah. We do make a lot of use of arthroscopic surgical techniques, which I think have been around for quite a while and get better really, over time regularly. And we do use a lot of that, particularly in the upper extremity, because it's a non-weight-bearing joint. Unlike a hip or a knee, we can really get by with a lot less invasive treatments, oftentimes for some painful conditions.
Well, and I think the other thing that keeps people out is the time. They're like, oh gosh, I don't have time to go to the doctor. I don't have time to be out of commission. I don't have time. I mean, we also have to ask ourselves, do you have time to feel badly all the time too? But this is, if something, you guys even take walk-ins, and you've got several locations. So usually they can get you in very quickly at orthopedic, at OSP.
Yes, you can come in our Manchester office. We have a urgent care center there that's open from 8 in the morning till 8 o'clock at night, Monday through Friday, and also from 8 in the morning till 4 on Saturdays. So you can just walk in without an appointment there and be seen, and it's very useful and helpful. And sometimes it's trauma related, but sometimes if you really have a hard problem, you can't take time off
like
from
you
work.
wake up and you're like, I can't go to work, my back is really hurting me. You could go to your urgent cares, or vice versa, your hand, your arm, something's just really flaring. You could just show up and you're going to be able to get in quickly. A lot of people fear like, oh, I don't have weeks to wait, but that's not the case.
No, absolutely. Yeah, and we have X-ray right on site, and we can do really a lot of things there to figure things out, and also maybe even get some treatment going, provide you with a splint or a brace, and kind of get you going. And it certainly avoids the long waits that sometimes can occur in emergency rooms and such, and we can usually get you in and out of there pretty quickly and efficiently.
Okay, so that's something to keep in mind, and it's Orthopedic Surgical Partners. If you are just joining us, we're talking about I've got Dr. Stephen Scarengella here, and we're just talking about what we need to know if something's really hurting. You're an expert in the hand and the upper bodies, but there's someone at Orthopedic Surgical Partners that kind of handles everything. As a mom, I always worry about the kids. And I guess, what do we need to know that fall sports are going on right now? If they come home and their hand is hurting after football, do we need to go see someone, or do we wait a little bit? What's the rule?
Well, generally I think kids I'd be careful with, because they usually don't complain. And I think if they're complaining, I would go sooner rather than later, particularly if it's a sports-related injury, because they tend not to complain. So usually when they are complaining, there usually may be something going on. And certainly if they're doing a contact sport, it's good to just be sure that there's not a problem, because again, you may have a simple problem that can be managed simply that could get a little bit worse or be more complex if not picked up right away.
And with kids, you might be thinking, oh, I have to go to the pediatrician first. Not the case. You could go right to Orthopedic Surgical Partners, and you have people who handle younger folk?
Absolutely, yeah. We see all ages, and certainly this time of year we're seeing sports injuries all of the time. So that's a common issue.
And that's something that you deal with. You've got some affiliates with some big athletes, like the Detroit Tigers. I grew up in the Detroit area, San Francisco Giants. So you're dealing with athletes even at the highest level. So getting our young people back to play safely is really important if they want to have a future in sports.
Absolutely, yeah. And it used to be, even in the professional levels, it used to be that, a lot of the athletes would, try to work through an injury or play through an injury, and really that approach has really changed quite a bit, even especially at the higher levels, because if you're trying to compensate for an injury, typically it's going to throw whatever you're doing off in terms of your mechanics and such, and it really can set you up for getting even worse and bigger problems. So we tend to be, fairly aggressive, especially with the higher level athletes, but really with every athlete, because it's the same kind of an issue at every level.
I always like to ask this too. Obviously, you're going to have some treatments from, anything from non-invasive surgery to physical therapy. You might actually need surgery, and you can talk about that and handle that as well. But what about just more natural things or lifestyle things? Are there any supplements that you ask your athletes and folks to take just to kind of reduce inflammation in general, or anything that we should be doing on a regular basis from your perspective?
Well, I think nutrition is important, and I think it's always something to look at and be very aware of. I know my wife's actually pursuing her master's degree and becoming a registered dietitian, so I hear a lot about that. And it is very important, because there are foods that can inhibit wound healing. If your diet's off a little bit, there's different nutritional things that can really facilitate healing, particularly from surgical issues, but also to reduce inflammation in joints as well.
Yeah, you can Google anti-inflammatory diet. You'll find a lot of information. But so full treatment of how we take care of ourselves. But again, Orthopedic Surgical Partners, I know you're just around the corner from our studios here in Rocky Hill. It's where you came from. But you have several offices throughout the state that people can visit.
Yes, yeah, we have an office in Avon, as well as our office in Rocky Hill and Manchester. And we also have an office in Willimantic, Connecticut as well. So
pretty much there's an office that might be convenient for folks depending on what corner of the state they're at. And if you want to learn more about where those offices are, you can just go to ospct.com. You guys all take insurance?
Absolutely.
Yes, that's nice too. I know people are always wondering, well, this kind of stuff covered. I think if you haven't really been to an orthopedic before, it's the first time you're dealing with pain, you might not know the procedures, but this is great for people to know that you can come in as the first line of defense and begin that treatment and find out what the options are.
Absolutely.
Yeah.
Absolutely.
All right, so check them out, and I want to put the information on the screen one more time if we can. There's the phone number if you'd rather just call, 860-525-4469. You can say you just saw Dr. Stephen Scarengella on Facebook Live with WFSB, and you want to get checked out. So you can call them to schedule an appointment with Dr. Scarengella or one of his partners, ospct.com. Thank you so much, Doctor, for being with us.
Oh, my pleasure. Thanks for having me.
Yeah, thanks for sharing your information.